Rishi Desai. He's Chief Medical Officer and a former outbreak investigator at the Center for Disease Control. And so here was one little piece. He talked about what's called a low inoculum. So if you're in a lab and you're going to inoculate a plate of medium in a petri dish, and you're going to like grow yeast or bacteria on that plate, the inoculant it uses is you dip a little wire loop into a culture, a liquid culture that has a bunch of whatever you want to inoculate, a bunch of bacteria in it, and then you swipe that across the plate, and that's called inoculating the plate. So he's talking about how the inoculum is how many of those virus particles you would get in your own body. So let's listen in here.
Where there is an interesting wrinkle, I kind of want to focus your attention on, is where you get a big inoculum. Right? So when I say inoculum, what I mean is lots and lots of secretions full of virus versus a little bit of a secretion full of just a little bit of virus. So let's say two scenarios. One, I'm trying to intubate, putting a tube down someone's throat so that I can help them breathe, and I'm right in their face, and let's say I'm not wearing my N95 mask because it's soiled or I forgot to put it on or I'm in a rush, and I'm kind of face to face, and that person just kind of coughs or sneezes or gags, and all of a sudden I get in my face kind of a shower of these particles full of virus. That's a large inoculum. Compare that to me being at a conference and me grabbing a handle on a restroom, and maybe someone had forgotten to fully wash their hands and they got some virus on that handle. That's a small inoculum. So these are the two different inoculums. What we know from the data is that when you get a large inoculum, you get sicker. And so the people at risk, I mentioned the elderly, but the other group at risk for serious disease are healthcare workers, because they're with the sickest patients, and the sickest patients tend to have the highest amounts of virus. So that's just one thing to kind of keep in mind.
All right, really important information in there, and it's that when you get a larger inoculum, you tend to get sicker. So I want to talk about this because this informs why I wear a face mask and how and why hand washing works the way it does. So I want to talk to you about viral loading very quickly. So what he's talking about in that video is that when you get a really large dose, like you have a large starting dose of the virus, then you have trillions of virus particles enter your body all at once, and then so they're starting from a very high level, and they start from there and take off like crazy from there. So I couldn't find a lot of information about this, so I'm only going to be able to give you representative numbers, but I thought two things. First, notice here with SARS patients, right, we're looking at a case here in Transfusion Medical Medicine Reviews from the 21st of February of 2020. So these people report that within 3 days after fever onset for SARS, again, this could be different here for the honey badger virus, just a little different. 19 out of 24 of patients had detectable SARS-CoV RNA in plasma, so that's in the blood. The viral load level rose fast, and the maximal viral load was around day 4 or day 5 after the onset of fever, after which the viral load quickly decreased. So this is almost certainly true that we're going to see that if you tracked your viral load in your body, let's say right here is where you get first exposed, and then it goes up, and you're going to have a lot of them, and then it's going to come down again like this. And it might be that up to here you're asymptomatic, so you are capable of getting infecting people with this, and we'll cover more of that data in just a second. But honestly, the amount of infectiveness you have here is not nearly as great as it would be here. And so what they're saying here is, at least for SARS, we see that the maximal viral load is around day 4 or day 5. So if we said, this is the onset of symptoms, day 4 or day 5, let's call this day 5 out here, right, is where you're going to have your maximum viral load, and then they're gonna go down after that, okay? And again, at some point you'll have sort of, let's say, minimal infectivity at some level where you've got it, it's detectable, but you're not really infectious, not compared to when you're just shedding them up here at the worst of it, all right? Their findings showed viral shedding in plasma, so that's into the blood, was common when people were clinically ill with SARS virus, and that plasma may be a better sample compared with nasal and throat swabs. That's probably almost always true. So looking at all of that, we don't know how fast this viral load is actually replicating in the body. I couldn't, well, I'm sure somebody does. I couldn't find out that data, which I wanted to answer this question, which is how quickly, how many hours does it take for this virus, once it's in your body, to double and double and double again? So I don't have that data, so I'm going to show you something representative that's going to begin to explain this idea of why starting with a low inoculum level would have a better outcome for you, and that if you get hit with a really high inoculum level, that is a big fat blob of trillions of virus particles, why that is associated with more serious cases. All right, so I just made a quick little table here, and this is representative only, okay? This is, I don't need anybody coming back saying this is inaccurate, because I know it's inaccurate, because I just made it up, but because I don't have good data. So let's just look through here, and this is the viral load you might have. And let's imagine, and this is totally imaginary, that it has a 4-hour doubling time. So if we got one virus particle in us, honestly, it probably wouldn't even make you sick, because you need there's some minimum threshold you need to get exposed to that would lead to illness. Anything less than that, and it's probably going to be unsuccessful. Why? Because maybe that one virus got in you, but it didn't travel in your body anywhere where it could possibly latch onto an ACE2 receptor before it got deactivated, by proteases in your bloodstream or whatever. But let's imagine that if it was able to replicate after 4 hours, there would be 2 of them, because it doubled every 4 hours. And after 8 hours, now there's 4 of them. And after 12 hours, there's 8 of them. And after 16 hours, there's 8 of them, and after 20 hours, you got 16 of these, and so on. See how this is just doubling like that? Double, double, double. So if you start with a low inoculum, and let's imagine, I don't know, this was, you got some virus particles off of a doorknob. Well, before this thing's exploded, and I'm just making stuff up here, but let's imagine that this is the number where you suddenly are symptomatic and having a lot of, that's where your fever first starts, okay? And I know these numbers are way off, but it's just representative. Look how much time you would have. You would have basically 2 or 3 days for your body to begin to mount a defense, recognize this invader, get your T cells all sort of spooled up. Your white blood cells are busy going there. They're identifying it. They're replicating. They're starting to make antibodies. They're mounting a defense. Your body has 3 days to do that, whereas if somebody goes ahead and just coughs into your face, maybe you're a well-meaning child who just picked it up at school, because kids like to cough in their parents' mouths for some unknown reason, and you start with this load, you only have 4 hours before you've gotten to a symptomatic load. Your body hasn't had time to adjust to this, and it's off to the races. These numbers are just exploding after that. So with a low inoculum, you have time for your body to adjust to it. So if we're all going to get this because, accidentally, no matter how careful we are, someday there's a particle drifting on the wind, or somebody coughed somewhere, way up in the front of the plane, and somehow we caught it. If you can start with a low level of a viral load, you give your body time to begin mounting that defense before your body gets overwhelmed. Okay, so that's my interpretation of that. And so, of course, the conclusion is wear a mask. Wear eye protection, wash your hands, right? That's why we do these things. I don't care what anybody in the government says, masks help. Are they perfect? No. But if the mask catches most of it and a little sneaks around the edge, and I get that, I'd much rather have that than just getting the whole blob because some idiot in the government said masks don't help because they forgot to order them and they don't want